Wow, good afternoon, everyone. It's so great to see so many people here. Welcome. My name is Lynn Duran, and I'm the Assistant Dean of Student Affairs in the College of Public Health. Thank you so much for joining the virtual MPH Applied Practice Conference Student Highlight event. We're so excited to have you all with us today, including current students, faculty, preceptors, and prospective students. We'd like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being the home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. As you may know, our Master of Public Health students from each of our campuses conduct applied practice experiences in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum, sorry guys, in which our students utilize their academic knowledge from the classroom in real world practical situations among professionals in the public health workforce. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual applied practice experience conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view our fantastic student presentations. Thanks. I'll turn it over to Kim.
Hello, hello. Welcome, everyone. I'm so happy to see such a great turnout today. Despite the Zoom moment that happened at the university today, we are all online at Zoom and happy to be here. So my name is Kim Barnes. I'm the Director of Student Affairs for our Phoenix campus, and I'm going to moderate today's panel. So we're very happy to welcome our student panelists today. We have Lady, Grace, and Kyle with us, representing our Tucson campus and our online campus across different concentrations. How the panel will work is I'll facilitate some discussion for about 30 minutes or so, and then we'll open it up to the audience for questions. You can ask questions of the whole panel. You can ask questions of each individual. We do invite you after today's panel, if you haven't already, to pop onto our website and make sure to watch the 3 wonderful presentations from our panelists today, among many others that you can choose from. And again, as Lynn mentioned, we'll share more about that following the panel. And so we're just going to jump right in. I'm going to ask each student, we'll start with Lady, to give us a quick, what I call like an elevator speech about your project, just to introduce and set the stage for each of our guests today. So we'll start with Lady.
Hi, everyone. Good afternoon. My name is Lady Elli, and my pronouns are she, her, hers. I'm currently a second-year MPH student with a concentration in global health, and I did my AP experience in Indonesia, particularly in Universitas Jenderal Sudirman, or UNSUD. So our college, the College of Public Health, does have a memorandum of understanding with this university, and so I work closely with our research collaborators from that institution to be able to do tuberculosis or TB-related stigma research and interview TB patients, TB programmers, and community health advocates around the issue of TB within the semi-rural setting of Purwokerto in Central Java, Indonesia. So this was a really wonderful experience because I was able to apply my skills, of course, in an international setting, but also to experience cultural immersion, cultural humility, and practice cultural awareness, which again are very important in global health research, but also very, very important with regards to MESCOF and MESCOF's mission locally, nationally, and also globally. And so I'm happy to share more about the work that I am doing later on with the questions that are coming up. And I'm also happy to answer any questions that you have afterwards.
Thank you, Lady. Grace, if you can share with us a little bit about your project.
Yes, so hi, I'm Grace. I'm a second year MPH student in epidemiology, and I did my APE with Pima County Health Department within the epidemiology division. So for that internship, I worked largely with Essence data, which is national syndromic surveillance data. It's near real-time data from hospitals, EDs, inpatient clinics, and urgent cares around Pima County. And it's really valuable because it offers near real-time data and is updated almost daily. And I used this to do a lot of different projects with various illnesses, such as vector-borne diseases, vaccine preventable illnesses, rabies, a lot of things. And I ended up developing a dashboard that helps Pima identify trends with this data with various illnesses and also um, also do early outbreak detection. So a lot of that was a really great experience, and it involved a really large data set with ICD-10 codes, procedural codes, chief complaints, and discharge diagnosis.
Thank you, Grace. Kyle, please share with us a little bit.
Oh. Hi, everybody. My name is Kyle McAnally, and I'm getting my MPH graduating this semester and the concentration in Health Services Administration. My project was working with the psychiatry department at Bay State Medical Center in Springfield, Massachusetts, looking at antipsychotic medication prescribing practices for elderly medical inpatients. And we were trying to understand what the risk factors were, or highest risk factors for that target population, what were some quality improvement opportunities we could have to improve patient care for that population. And in service of that for the department, I worked on a survey of the prescribers for that specific type of medication to give out internally to kind of understand how things were going, and a couple of different quality improvement plans to try and improve different workflow and processes for that.
Thank you all. I jokingly shared earlier when I watched their presentations today that they did very aligned projects to their concentrations. I could not have like scripted it better. I mean, ladies of global health, Grace is county epi, Kyle is HSA QI. I mean, it just was magical for me to have that moment of like, this is what we tell people that projects might look like, and you all really showcase those examples. Thank you for giving us the little brief introduction. Again, we invite you to watch their full presentations when you're able to. So I'd like to know, and I think lots of students, both prospective and continuing students, often want to know, how did you find, secure, or develop your experience? Did you apply, LinkedIn? Did you create it? What did that process look like for each of you? Anyone can jump in.
Yes, I can go ahead and start. So one, I had a very supportive faculty advisor. So my faculty advisor has been my mentor ever since I was an undergraduate. And so it just so happens that she's also my faculty advisor now as a graduate student. Her name is Dr. Priscilla McGrath, and she has been really instrumental in allowing me to do whatever I want to do in terms of global health and really reach those dreams and goals. And so she was the one who had experience working in Indonesia before she taught at the University of Arizona. So she already did a lot of international development, a lot of consultancy work. And because of that, she was able to really facilitate those connections with our Indonesian collaborators and also establish the MOU with Universitas Jenderal Sudirman, because we did not have an MOU yet with that university, but we did have an MOU with a different university, Universitas Indonesia, in Jakarta, Indonesia. So it was a really wonderful opportunity to be able to collaborate with my faculty advisor on this effort, and then eventually get to, doing the research, being in Indonesia and immersing myself in that opportunity. One thing that I would like to mention is that I feel that people always have the idea that for an APE, they have to apply to something, but there's also the option of being able to craft your own APE experience. And this is definitely the case for global health experiences. So in my case, within MESCOF, we do have Global Health Institute scholars where you will be matched with host organizations. Everything is set. You can apply for scholarships. Whereas for me, mine was completely independent. So I had to start it from the ground up with creating MOUs, finding research collaborators, meeting with them on Zoom, and then finding funding. But I don't regret it at all, because it was definitely very much catered to my experience of doing tuberculosis research in Southeast Asia. So it checked all those boxes. And if you're just pretty much, the type of person that has an Excel sheet tracker, has, kind of your notes app always on the go and making sure that you have those consistent meetings with your research collaborators, but also with your faculty advisor and academic advisor, that you're pretty much good to go. And it just really depends on you if you're good with already preset, pre-made opportunities through the Global Health Institute Scholars, which is a different program that we have, or if you'd like more catered specific opportunities that you can also work towards and even have full funding, which in my case I did. So it was a great experience. And yeah, just wanted to reiterate that you can also cater to your specific interests and tailor your experience to what you'd like to get out of your specific program.
Thank you, Lady. Yeah, I think it's a really important point you make. And I'm excited to hear from both Grace and Kyle about how they found their projects too. But yes, you can build something from the ground up. You can create exactly what you're hoping to do, usually with a little help from someone, a faculty member, a connection you have. Those resources are really, really valuable. But so are finding internships to apply to, APEs to apply to, and to find what fits your needs. So Grace, can you tell us how you found your project?
Yeah, of course. So I found my project through a AmeriCorps public health corps application. So I applied to my project. It seemed really interesting from the get-go, and I always wanted like local health department experience. And it was a partnership through the Pima County Health Department. So I applied, and that's how I secured my internship. I heard about it both through LinkedIn and the MESCOF MPH listserv. So definitely check those emails if you're like looking for opportunities. So
We'll never turn down a read your email plug in student affairs, I promise you. Kyle, how about you?
Yeah. My process was a little prolonged, and so Dr. Gerard was absolutely phenomenal in helping me kind of navigate that process on the school side of dealing with trying to find an APE. And then I had sent an email out I had already worked previously at Bay State in a research department. And so trying to find something that was more health services administration focused. I really wanted something that wasn't, a lot of people had different research projects they needed extra hands on, but I really wanted something that was just at the operational kind of level. And so I'd sent up an email kind of outlining my ask of a lot of different people and said if they knew anything going on that kind of fit the bill. And I got a couple of responses back, chatted with a few people, but I ended up reaching out to the head of the epidemiology and biostats department at the time within the hospital and asking, are there any QI projects you have going on that need extra hands? And through there, I was connected with Dr. Flannery Meredith, who's in the psychiatry department there. And she was already kind of looking at trying to it started a retrospective chart review of the data, kind of looking at future quality improvement implementation for this population of elderly inpatients. And so I chatted with her about I need to come up with some deliverables, and this aligns very much with my concentration and what I'm wanting to do in improving operations and patient care and making things easier for the caregivers. And so that's how I found it.
The power of the cold email, right? We used to say cold call. Nobody cold calls anymore. It's a cold email, but it works. And sometimes you have to be tenacious and you have to continue, and you might not get that first response, but if you emailed in and sometimes the magic happens. And those connections can be really powerful, both those that you've had before and, like Lady and Grace mentioned, those that you currently have either through the network of emails or postings on LinkedIn, or your faculty mentor and a really good sense of what you want to do. And then you can start from there. I will emphasize the importance of that early piece, right? Doing things early. I'm seeing 3 nods, right? Doing things as early as you can to really set yourself up so that you're not scrambling and you have time for hiccups or to develop the project that you want and not just inherit something that maybe isn't great for you. And so I think that that's really fantastic. So the next question is, it's connected. What was the most challenging part of the planning process for each of you in terms of getting your experiences ready to go? If there were challenges, maybe there weren't. We'd love to hear that.
I can go ahead and start too.
Yeah.
I can clearly remember 2 things that were challenging. I think the first thing is because there's so much paperwork that needs to be submitted, and I'm not talking about just MESCOF, right? Obviously, you need to have paperwork because as master's students, you need to be able to write about the work that you're doing and showcase the impact of that your work is going to have later on within your fields, whether that's global health, epidemiology, so on and so forth. So I understand that, but because there were so many types of documents that were needed all at the same time from different sources. So I remember the documents were needed for MESCOF, obviously for AP submissions. Documents were needed for the MOU submission, Memorandum of Understanding, for the University of Arizona and the University in Indonesia. Documents were also needed for IRB submissions because mine ended up being a human subjects research project. And then there were also documents that were needed for IRB in Indonesia, and that was an IRB on a national level. And so they required a lot of documents as well, from both pieces, right? From the University of Arizona here in the US, and of course the university over there. And so there were just a lot of documents and there were multiple deadlines, but that's why I said earlier it's really important to have kind of that Excel sheet tracker and, have reminders on your Google Calendar and always have your notes app on the go. I think I remember too, that being said, the ethical clearance, right? If you want to do research as your AP experience, Kim mentioned starting your AP paperwork and starting those discussions as early as possible. And I 100% agree with that, because with that, you also have to get clearance for research, as I mentioned a while ago. And a lot of the times, if you're doing global health research, you're getting clearance at the university level here in the United States, but you would also need clearance within the country that you want to work in. And so that's really important, especially if there's some bureaucracy going on in there. So what happened for my experience was I expected to be in Indonesia only for 1 month conducting research, and that was obviously with a mindset that all the paperwork for the ethical clearance in Indonesia had already been approved, but then I ended up going with it still being reviewed. And so I had to actually stay in Indonesia for 2 months instead of 1 month. And so you get a lot of those global health experiences where nothing is ever going to be perfect. You just have to be flexible, cultural immersion, awareness, humility, all of those things, right? Applied while you're there in person, and just being patient. Another thing too is it's really important to maximize the connections that you have there locally, because obviously in countries like Indonesia, it's who you know that will get you to finally approve the ethical clearance documents and process that you have over there, and just making sure that you have all of those set. So navigating a lot of those things was really interesting. It was challenging, but it was also really interesting. And I think it's still good experience to know what global health research looks like.
Thanks, Lady. Yeah, I think that to emphasize that students doing global projects, students wanting to do human subjects research, the earlier the better. And we can have conversations about what that looks like, talk with your faculty about what that looks like, and don't be afraid of it. If that's really what you want to do, just do it. And so I think that that's something I hear a lot is, well, I don't want to do this, so I'm not going to do the project that I really want. And that breaks my heart. So let's figure out a way to make sure that happens. Grace or Kyle, do you have challenges that you faced during your project that you'd like to share about?
Yeah. Challenges I faced during my project, at least in the beginning for like getting it started, was I had a lot of training I had to do. I had to do FEMA training and HIPAA training. And that was all very valuable, I think, to my professional development, but I was really eager to get going. And then I also had to request access to data, access to Essence, access to MedSys, access to all of these things before I could get started. And those things are really important to do, but I was also really eager to get started. I also had some difficulties with really understanding Essence as a whole. It's a very complicated and large data set, and a lot of the variables are a little bit unclear. And the data dictionary is also a little bit unclear. So I really had to play around with it, test some things out with some EPIs that were on the division, and really try to get a good sense of what this data was saying, so then I could interpret the findings correctly.
Yeah, I think the point you make there is really important, which is that an internship isn't just you giving something to the agency and being valuable and working for them. And, like Kyle mentioned, sort of, where do you need help? It's also about your learning. And so giving yourself some grace and some time and some space, say, oh yeah, I'm learning. I really want to be neck deep in the project, but wait a second, I have to back up and learn these things. And finding a supportive organization that encourages or requires that training is really helpful to make sure that you're setting yourself up for success. Kyle, what about you? Challenges you faced?
Yeah, I'll say kind of the startup phase, because they had just gotten a lot of their chart review data and were kind of going through it, and getting a lot of physicians together in one room to kind of talk about it or on a meeting is very difficult. So getting the time, trying to find, and since my internship was remote and I'm with the University of Arizona online campus, just trying to find ways to have very detailed like agendas or goals to push out for, I think these are some steps that might be helpful towards this. What do you think? And I really needed their feedback a lot of different ways, and trying to make asynchronous emails or other things when you couldn't meet in lieu, just to get what is the next step towards better understanding to make more progress on the internship goal. So that was a little slower because we had to sift through all the data for a year, look at what were the most important questions we wanted to ask of the medication prescribers at the hospital based on what we were seeing in the data, and kind of inform the quality improvement plans based off of that.
Yeah, I think that that's noteworthy, is that scheduling can be really tough. We all know that, right? Being remote adds an element there. But I think what you said there is really important, which is that there's a moment and opportunity to practice your leadership skills and sort of that agenda development and how do we move it forward? Because so often these projects are really amazing and really in depth, but sometimes that means you stew and you need to go forward. And so what's the next step to make that happen? And obviously you're interested in optimization and efficiency. So I think that is telling to say, okay, what's next? Where do we go from here? But those are opportunities to practice those skills as well, if you don't already have them in an internship as you grow and learn. So I'm really interested to know if you can describe sort of one of your favorite or really unique experiences that you had during your APE. Doesn't have to be unique to everyone, but for you, what was something that was like an aha moment or a really special moment for you during your experiences?
For me, I definitely think that something that was really unique and also really rewarding for me was getting to contribute to measles enhanced surveillance within the Pima County Health Department. It was towards the end of my APE, but I think it was just really a great experience, and it was a great way to like get to have see immediate impact. You know, a lot of these public health projects and research that we do, like it's a slow building thing, and that's a good thing because it means like it's having a really strong impact, but like seeing those immediate impacts at the local level is just so rewarding to me. And what I was able to do was I was able to use code that I previously developed for different project within my APE to pull information about suspected or probable measles cases using Essence data. And I was able to basically say when this hospital visit was and from what hospital or urgent care visit or inpatient clinic it was from. And then the EPIs were able to then take over if my report found a suspected or probable or potential case. And then they were able to call the hospital and conduct enhanced surveillance, which is really crucial, especially if these institutions will get to report for a potential measles case slips through the cracks, especially with the increase in measles cases that have been happening in the US lately. So that was a really unique experience I feel I had.
I mean, talk about timely, right, Grace? Like you're right on it. And yes, sometimes public health doesn't give you that instantaneous reward. You know what you're doing is going to be helpful 1, 2, 20 years down the road. So to have a moment that's like, I did this great thing, and that has to feel really rewarding. Lady or Kyle?
Okay, I'm gonna go ahead and share. I think there's a couple of things from behind the scenes. I don't regret whatsoever doing all of the work to get to, the final output, which is my TB research in Indonesia, because it allowed me to practice the skills that are necessary eventually when I want to pursue a PhD in public health. And so I was involved in kind of doing the paperwork and the ethical clearance process, but I was also involved in funding my research, which is really important when you want to apply for grants to be able to do your dissertation. There's also an aspect of being able to collaborate with research collaborators in a different time zone, in a different country, and being able to communicate with them and, share what you want to get out of this experience, but also learn to balance it with their expectations and what their asks are. I feel that also collaboration with a faculty advisor is also really important for this experience. And just the logistics of everything was super, super important. I feel that I will carry that with me when I pursue a PhD in the future. The second piece that was very unique about this experience, I would say, is the cultural immersion piece. And I think that a lot of the times, like when you're doing global health work, people forget that there are a lot of practices overseas that you also have to respect, right? And you also have to take into consideration because obviously it's a different country, different culture, different set of values and beliefs. And so it hit me when my research collaborators, these were my research assistants that were college students, but also graduate students. In our first interview, they mentioned that for the entire day that we'll be doing interviews, they would have to take some breaks because, of course, Indonesia is a predominantly Muslim country and they do practice praying 5 times a day. And so they just told me, before we do our interview, I'd have to pray, or I probably have to step out during the interview to pray. And I think that was really beautiful and that was really wonderful. And I think that, here in the United States, we're pretty good about setting boundaries, right? And I think that's also kind of the same mindset that I practiced when I was overseas, knowing that different people, again, have different values and have different traditions and customs that I have to respect. And I think that's just a very beautiful part of global health. And very different from how we do things here in the United States as well. And overall, I think that the entire experience was just very unique, especially because it was in a global setting. And what Grace mentioned, and what you too mentioned, Kim, a while ago about how it being very relevant in our world today. I mean, TB cases are rising, not just in different parts of the world, but also here in the United States. Also, the opposition to global health. But I think that it's high time for us to continuously involve ourselves in these types of efforts because of course of, as you've heard from what I've been saying, how important global health is and how important global health security is for all countries around the world. So had a really wonderful time with this APE.
I will say too, Lady, one thing I found really interesting watching your presentation was that some of the stigma that you were researching was from the healthcare setting. And I just found that so interesting because I think sometimes we think of the stigma coming to the patient from maybe the community or other people and how that impacts, but when it's the other way. And so I do think that it seemed like that the cultural exposure, it's learning a whole new language. And I don't actually mean spoken language, right? It's the whole like cultural existence. And you're right, it seemed very beautiful. It seemed like a really cool experience for you to connect that way.
Yeah, sorry. Just wanted to add real quick. Sorry, Kyle. But I think it's really interesting because I was actually born and raised in the Philippines, not Indonesia, but I decided to challenge myself with this extra layer of getting to know a different culture and being in a different country that I haven't been to before. Although, of course, there are shared, customs and traditions between the Philippines and Indonesia. So it was a really wonderful opportunity to be there, and I really liked that I continuously challenged myself throughout that experience.
Yeah, super important. We don't, my ideal for students when they're doing their AP is that they're stepping out of the comfort zone, whatever that looks like for them, and challenging themselves to do something new and something hard that can be really, really rewarding. Kyle, what about you? Something unique?
Yeah, I'll say what I found the most unique is in getting the survey results back. You can plan for what you think people are going to say. You kind of want to get a spread across the whole gamut of like, what are you going to do with this once you get these survey results back? And then having my preceptor, who is a physician, be like, oh, I wasn't expecting that. Those are the types of things like, what do we do with that then? And having worked in multiple different healthcare systems in Alabama, Massachusetts, and now in Maine, every level of care provider or administrator, you come into a culture, you come into a system, doesn't mean there's methods for improvement and supporting other people. And you have the mandatory trainings you do, but like how much do people, when they're having to do documentation for all types of patients, many hours, a lot of other things get pulled away, things just fall through the cracks. And so it just shows kind of the importance of no matter what level you're at, having kind of good systems in place and good support for those people especially for our system talks a lot about productivity, or how do we treat patients the same across all different entities within the same health system. So those kind of important things related to the system level I found really fascinating. And there's a small system of it, and just how different it could be for what people were expecting even, and just thinking how to improve that.
Yeah, I always find it interesting. We surveys, right? There's always surveys, there's always something. And yet we act surprised or are surprised, but we asked them in the first place, which means we knew we didn't know. So why are we surprised that we're getting information we didn't know, right? But still, because you assume things are operating in the way that you think they are or how they are. And so I think that that's an important thing to think, regardless of internship setting, right? Learning the culture, whether that's organizational culture, actual culture, whatever it might be, is an important part of this experience, right? So that you can then figure out what you know you don't know, so you can start somewhere, improving a process or a public health work or whatever it might be.
I will say, yeah, because I've worked on a bigger survey of like cardiac rehab practices across the country, and it felt so different because of how small this was and like what the goal was. Because that was writing a paper and understanding like the bigger bellwether of like what's happening for that specific niche of care. And this one is, what are the few things we're going to do with the people? And like surveys, the most direct method of like, how do you ask these people? And trying to come up with this question was a lot of fun. And I liked working with the different individuals who know more than I do about what are the pointed questions we should ask. Because I could bring my knowledge that way of how to design the survey and what are the best ways to present the questions to people and get it out to them. But I don't know the questions to ask. I don't know what's the best ranking or how many we should include on these things, but learning that was very enjoyable.
Yeah, it is amazing when you bring together a group of people, how you might have gone through the survey and had a few different pieces of feedback, and then all of a sudden all this other feedback comes in, and they were just things that you never even thought of. But that's why collaboration and perspective is so important in all of our projects, right? That's the power of public health, I think. Okay, so my next question, and it's kind of similar. I think it's a little more in the vein of how your projects progressed. But were there any significant moments where you really had to pivot? So you were on a particular trajectory and you had to take a sharp right. Or did the project function mostly how you anticipated with maybe a few small pieces? The answer could be, no, I didn't have to pivot. It's okay.
I guess, what I mentioned a while ago, the biggest pivot was really being able to be flexible with my timeline, because I expected to be in Indonesia for a month. 30 days is very different from 60 days in a different country. And so it was a very interesting experience. But instead of being, woe is me, it was very helpful to have my faculty advisor there the first couple of weeks, because then, we didn't waste our time. We did a lot of cultural immersion activities, but we also did a lot of what was in our MOU, which is to do outreach to different schools, do presentations. And so we were still very productive. And I got to learn so much about the culture and about how they do things in an academic setting, how they do things in a public health setting. And so it was really interesting. And by that, I mean, I know there's an article about this that's published on the Mezcov website about the experience that Dr. McGrath and I had, but we actually went to both universities that we have MOUs with, one in Jakarta, and then the one in Purwokerto where I'm doing my research. And what we did was we actually had presentations about health behaviors and kind of talking about health behaviors in an anthropological setting. And so it was really wonderful because, we presented it to nursing students, to public health students, and to med students from both universities, while also, again, getting to interact with them and hear their experiences and do something interactive in those presentations where we had, kind of this skit parts involved in the presentation so that they could kind of do the role play and interact with each other. And so I could see what it looks like in an Indonesian healthcare setting, or, looking at the Indonesian healthcare system in general. And so it was a really wonderful experience. And aside from that, Dr. McGrath also introduced me to her network when she was doing water sanitation and hygiene programs in Indonesia, and some of her friends in a different city, which is Bogor, Indonesia. And so it was a really wonderful opportunity, just being able to immerse myself and just continuously doing work while waiting for ethical clearance. And so there was never a dull time, but obviously the timelines just had to pivot.
Those timelines always build in the flexibility, and that goes for global projects and that goes for local projects. Always have some flexibility there. Grace or Kyle, did you have an opportunity to engage in pivoting?
Yeah, I mean, I think a lot of my project was pivoting, which I think I really loved, surprisingly. I mean, my preceptor really let me take the reins on like my project with just like an end goal in mind of being able to really utilize essence data, have the local epidemiologists be able to utilize this data, um, and really help to identify trends of the morbidities that are happening in the county. And so it was a lot of like playing around, uh, really trying to strengthen my data visualization skills, getting constant feedback from different EPIs about what is useful versus what is not useful for them and for the various different types of morbidities that I was getting descriptive data on and trend data on. So it was really interesting because I then realized, okay, because EPIs in Pima County Health Department are grouped by morbidity groups, like there's a vector-borne disease EPI, there's a vaccine preventable disease EPI, then it would be useful to have a filtering option in my data, in the data tables that are produced through my dashboard to then have them grouped by morbidity group, so then they can easily search the dashboard by the various morbidity groups of vaccine preventable diseases and vector-borne diseases and uh, other morbidity groups like that. So it was a lot of constant pivoting and a lot of reacting to the feedback that I got. And I think it was a really valuable experience too, because getting to lead my project um, with very little well, I had guidance, but I was able to take the reins. It really allowed me to learn from mistakes I was making, finding solutions on my own, and really, making the most out of my experience.
Those falling forward moments, right? You keep that momentum, you keep it up. But I love how excited you got when you said, yeah, my whole project was pivoting, right? Like you liked the energy of kind of moving through things. And I also think you really emphasize the power of the intern, right? Like you are a new person, new perspective, new organization. And so you get to come in with new eyes and maybe see things or think of things that folks who've been there for decades haven't, because they're so immersed in what they're doing. And so I think that that's something we want to make sure preceptors and organizations know, is that this person coming in is going to have, they're going to need to learn, but they're going to have new ideas and new ways of thinking about things that usually are to the benefit of the organization and to the team. And so I really like that you shared that. Kyle.
I was gonna say, I don't think mine was much of pivoting, but I brought ideas to the table and and we would go through why they wouldn't work in the situation. Because you could look through the literature, you can look at what other systems kind of do and what might be of benefit. And based on the resources the team has or what the realities of their workflow for that patient population, for the amount of people they have from day to night to weekend, for whatever the staff is, it might just not be feasible. Or what is the technology? What is their healthcare EMR? So many things. So that didn't really pivot and just consistently narrowed things down. But the closest I got to it is when I'd come with a bunch of ideas and we talk about what actually is going to work towards getting us to the end goal we want of improvement for the patient care that population.
So you made them pivot, which is, it counts. Yeah, that counts, right? Those are pivot moments. You really sort of challenging them to think about things, or them challenging you in that kind of bi-directional quality. I love that. Okay, I think I'm going to ask one or two more questions, and then we're going to open it to the audience. And if they don't have questions, I have more. But I'm really curious to know what you felt you learned about yourself during this experience. So what's that self-reflective piece? And it can be professional, it can also be personal, just something that you feel you learned about yourself. Ooh, this was the hard one, eh? Great, start us off.
For me, I think what I really learned about myself, I guess in terms of like career goals, is I always wanted, like in my head, I was like, oh, like I definitely want to work for the CDC. Like that's where all of the like impact is. If I want to make like a big impact in public health, like for the US, the CDC is the way to go. And then, I got my internship with Pima County on a local level. And then I realized, you know, there's a lot of like impact happening here that I didn't really get exposed to. And um, there's a lot of things where you can see like the base level impact. Like you can see the type of people you're helping, and um you can see how the projects are directly impacting your community. And I feel like that's like definitely super powerful. And I at first I was, I couldn't see myself working in a local health department, but now I can definitely like see myself working in a local health department. And it also taught me about like the vast differences of like bandwidths that local health departments have versus state health departments or at the like national level. And that it's they're really working on the ground doing the best that they can do. And I think that's just amazing, and how they're always like working towards getting more resources, getting increasing their bandwidth to really make the impact that they know they need to make. Like I feel like they have like a really microscopic lens of like what they need on the local level. So
I love that. The power in sort of changing the community you live and are a part of, and getting to see that work, right? You worked with real-time data and you got some real-time feedback and results, and that I think happens more at the local level than it does at the national level, right? You can have that there. And I really, really like that. Grace, that's great. Kyle or Lady, what did you learn about yourself?
I would say that I think I've been living the goal that I've set for myself. So it's kind of a living the dream moment, just because when I decided I wanted to major in public health, and this is like way back when I was an undergraduate, I always wanted to do global health research and particularly give back to Southeast Asia, which is obviously my region. I think it's such a privilege to be able to get an education here in the United States and then get those skills and that knowledge and then go back and eventually give back to those communities, especially in rural communities, which, Purwokerto, the city where I did my research in, is a semi-rural community. And so I feel that it was definitely kind of a dream come true moment. And that when I was there the entire time, it just solidified why I wanted to be in global health and continue that type of work. There was never a moment where I was like, maybe a different field or maybe a different path. And up until now, when I'm doing the data analysis, which is kind of the nitty-gritty part of the work, and then obviously doing the poster presentations and the PowerPoint presentations that we had to submit, where I have to do a lot of kind of the, after the on the ground field work type work, that I'm still motivated to want to be in this type of field. And so that's something that I realized about myself. Another thing too is that I used to think that I was pretty good about, sending emails and communicating regularly and asking for help. And that completely changed doing the work that I needed to do for global health, the paperwork and just the collaborations, because you need way more actually. And that you shouldn't be afraid because people are actually more than willing to help out is something that I realized throughout this process. I think that a lot of the times we feel that when we're doing the work that we're doing, that, we're being a burden to other people and you're only being a burden to other people. And I think it's really important to consider that you all are working towards the goal. I mean, of you having to do this research globally, locally, nationally, whatever, wherever you are, your advisors, your faculty mentors are there for you to want to do this work to achieve this goal. And obviously, you're also working towards that goal. So just continuously putting, having that in mind and centering that in the discussions. And if you feel that you're a little bit discouraged because there's just so much work and there's just so many things on the Excel sheet, to continuously have that in mind and to feel that, to always remember that you have that support system, I think is really important.
If you don't ask, the answer is always no. And, you started it by saying, my dreams came true, but you made them come true. And I think that there's power in like you had this goal and you said, I'm going to achieve it. And then figuring out, okay, what are the 8 million steps to get there and not being discouraged. So again, I've heard time and time again with all of you, hard projects, the tenacity in getting things done and moving things forward echoes through all of your experiences, which I think is really amazing. Kyle, what did you learn about yourself?
Yeah, just gonna say that I said this in my presentation, but this is absolutely the right concentration for me because I love understanding the systems and there's so many. I don't think I'll go out of a job from AI for trying to improve processes and systems across healthcare because it is such a complicated network and no two look the same. They look close, but the amount of resources, the people that come in and out and change, there's so many things that are always going to need just people to be mindful of that. Otherwise, because all these systems you can't take for granted is just like running because people need jobs. There's so many other things that make it work better than it is. And so that's what I'm very excited about. And this was kind of my project was a stepping stone out of research and into a healthcare analytics and like operations role that I'm in now. And it's truly was a lot of fun. And that's what I'd say I learned the most about myself. That was.
Yeah, like I said, your project's so well aligned with your concentrations. They're very, when somebody says, well, tell me about HSA, I'm like, well, you might want to do QI in a hospital. I mean, it was just, right, these things well align with the concentration. So to hear you say, like, this was affirming for me. In fact, each of you have said this is affirming in some way. Grace, you had a little bit of a like redirect in terms of the type of organization, but still doing the work. I think that's what internships do. They either remind you that you're on the right path or and confirm that for you, or like send you from the baseball field to the football field, right? Like maybe it's just not quite the right path for you. And I was one of those people way back in the day. Like I was one weekend and I was like, not for me, but yay, I'll do this project, right? And I think that happens as well. That's equally powerful. But I love that each of you found your thing. It makes us so happy, and in the student affairs and all of your faculty to hear that you did the things that really were powerful for you and have brought you joy. With that, I'm going to open it to the audience. Do we have questions from anybody in the audience? You may unmute, raise your hand, or use the chat, whatever you're comfortable with. Chase, go ahead.
Yes, hi. I had a quick question. I guess this is for everyone, but mostly for Grace. What was one highlight and one low light of, this experience for you and like this project for you?
I'd say a highlight for me was definitely getting to connect with so many different epidemiologists. I had the opportunity to have a one-on-one with almost every epi in the Pima County Health Department, and I think that was a great learning opportunity and career development opportunity because I got the opportunity to learn about their career paths and their skill sets, and then I think it was just a really great opportunity overall. And I was able to make a lot of great connections because of that. I think the low light is probably, again, like the Pima County Health Department, because it's a local health department, they do have some limited bandwidths and some limited resources. So for my dashboard, I had to use our studio for my dashboard. And it would have been really interesting to get to use a different type of dashboarding software since our studio has some limitations with its dashboarding and it can only handle so much data. But I'd say that was a low light of it.
Lady or Kyle, do you have a highlight, low light you'd like to share?
Yes, I would say the highlight of doing global health work is that, again, you get to see the different customs and cultures that are very different from kind of the American society. Indonesia, like a lot of Southeast Asian countries, it's very community centered. So you're there for not just for an interview, but you're going to expect that they're going to invite you for lunch or dinner afterwards in their own homes, even though they've only met you for that 1 to 2 hours that you've been doing the interview and building that dynamic, which is really beautiful. And that's something that, I miss because I'm from the Philippines. And that's something that I wish we incorporated a lot more in global health research is understanding that there's a dynamic outside from just, the professional interview setting that you'd have to build with the people that you're interviewing. So that's one thing. I think a low light would be leaving Indonesia. I really loved it over there, and I highly, again, for folks that are doing global health research or in the global health concentration, your classroom is out there, and so I highly encourage you to get those experiences and to not be afraid, even if it's a country that you've never been to or you're not completely fluent in the language. It's important to do some research beforehand and learn, the language a little bit, but kind of lean into it and see if this experience is a great fit for you.
I love that, lady. Thank you so much. Kyle, highlight, low light.
Yeah, I'll start with a low light, and I'll say mine was, and this is kind of related to the question Cassidy asked in the chat. It was very difficult with the full-time job and doing the internship in classes, and so I purposefully ended up spacing things out for my program, and that was stressful for me, obviously. But the highlight of that is everyone at the staff at University of Arizona were very helpful. And anytime I was more stressed about it than I should be, I would reach out and they helped me come up with a plan and made me feel a million times better. And I wish I'd always reached out earlier anytime I started feeling that way. And for the project specifically, it was getting to embed myself within the psychiatry department, some of the groups of going over the chart review data, working on iterations of the survey, and just getting to know them. They're a good group. They cared, and there are people who cared to ask a question about how are we doing on this thing? We don't know. Let's find out the answers. And those are the people I like working with.
Yeah, it's always great to work with people who are self-reflective, right? Like the whole project around, we might not be doing something right. Can you help us? That's vulnerable, right? And thank you for answering Cassidy's question. Cassidy, sometimes we have students who, just like Kyle, spread things out with their program. We have other students who aren't working full-time or working near full-time. And then we have some that do both. I'm not sure how. Lady or Grace, were you also working full-time? Lady, I assume you were not because you were on site for 2 months. Grace, were you also working full-time?
I wouldn't say I was working full time, but I was working 20 hours a week for my GRA ships and then 20 hours a week for my internship, my APE experience. It was a paid internship, so I was working 20 hours a week. And then I was also doing some research projects that I was not paid for, but I was still doing for like my own benefit. So anyone who knows me knows that I have a tendency to bite off more than I can chew. So I really tried to just have a really clear schedule of, okay, at this time, I'm gonna do these tasks for this job, and these tasks for this job, and this time for homework. So it was just a lot of scheduling that I did, and a lot of coping with stress, like healthy coping mechanisms for stress.
I like that. Thank you for plugging the healthy coping strategies. Grad school is a stressful time for everyone, different levels, whatever that might look like, whether it's paid employment you're balancing, family, research projects, obligations, extra months of travel. I mean, whatever that might look like, right? There's balance to be found. And I appreciate all of you being so open and vulnerable with us. Do we have any other questions from the audience today?
I was going to ask a question as well. As somebody who's also did the APE experience, do you guys all three feel like the image of a perfect student changed throughout like the experience? I feel like for me, I had to like erase the image of a perfect student when I did my internship work and really be the real world of person of like throwing ideas out there. So I wonder if you guys felt the same way on that as I did.
That's an interesting question, Susan. Just to clarify, you mean like a image of a perfect student for
Like
myself?
when you turned in like your APE work, did you like always feel like, oh, is it perfect enough or did I do a good job, thinking like there's a grade with it? Because like that's how I was for like a big portion of it. And then eventually I like my learning lesson was like, you can't keep turning everything in thinking there's a grade to it, but rather like you're supposed to get something from it if you didn't do it again and like not be afraid to like make those mistakes and like turn in another product. So that was a huge learning experience for me. I wondered if you guys had the same experience as I did.
Gotcha. So on the kind of sense of perfectionism, I think is where you're getting at. I would say that global health, again, is never perfect. And I think I had that expectation coming in that it's just going to be the timelines are just going to be all ruined. Whatever I put on the Excel sheet is going to be completely different tomorrow and 2 days after that. And so I think even though the consequences, the circumstances obviously are not perfect, I would just try my best to be resilient. I think something that I discovered being in the MPH program is it's not so much being perfect, because sometimes, perfectionism in our fields, don't exist, or most of the time they don't exist. But that I think resilience is more important, especially with public health in general, all the different concentrations and fields is something that I was able to value more through my global health work.
Leaning into the falling forward, I think is a good lesson to learn, Susan, and you learned it. Grace, Kyle, what about you?
I definitely think, when it came to the abstract, I did think, okay, like this does feel like an assignment. But I also got excited because it was like a chance for me to show off like what I did. But I was nervous for like my faculty advisor to read it and give me like feedback and everything. But when it came to my presentation, I think I was more confident as well. Mostly because I was getting so much encouragement from my preceptor and from people within the epi division at Pima County Health Department, that I was really just feeling confident. Okay, like I did something that they will be using and that they will get use of for the foreseeable future. Um, so I definitely think with the report, I'll be more like, okay, like I really need to come through this, make sure this is perfect. But I think for the presentation, I was just happy to show off what I did.
I love that. You should be happy to show it off. Kyle.
Yes, Susan, I was going to say, it's definitely something I still struggle with, not in the perfect student sense, but of perfect is enemy of good. And just trying to think and tell myself more, everything needs to be iterative, because you alone are not going to be an island that knows every single thing, especially as a student, especially coming into any experience or any. I've been doing different like research careers for like the past 10 years in different positions. And so it's always about learning and being interested and engaged. And for research, it's easy because it's there, you're doing it for the patient. There's a benefit that it could potentially be had to including this patient and letting them know what's out there. And for this, it's improvement for yourself and kind of learning something new and getting better at a skill that you might not feel as good about. So yeah, that's why I would say the iteration is what helped me get past that for most things.
Thank you so much. Lady.
Yes, just wanted to add real quick. Kyle is amazing, by the way. We're in a different class together. I think and a lot of the times he undermines his talent, but he's doing a great job. But I wanted to say that showing up is also really important every single day for the work that you want to do, especially if you have that goal in mind. I want to do my research internationally, and in order for me to get there, these are the steps that I have to do. And every single day I have to put in the work and I have to show up. I mean, the time zones here in the US and Indonesia, or just Southeast Asia in general, they just don't overlap. It's just really weird and wonky. So, like, a lot of the times it would have to be an 8 p.m. or a 7 a.m. meeting. And you have to be prepared for those meetings, right? Because it's a lot of analysis, it's a lot of, talking about next steps and action items and how do we, get to that next step. And so it's really important to just, again, as I said, being resilient, leaning in, but also showing up, even though you don't feel like your perfect self or you don't feel prepared, but just, being present and being ready to discuss, I think is really important.
Thank you so much. I know there was one other question in the chat, but to be respectful of time, we are going to close out. I will ask maybe our speakers if you could jot some notes down and we can make sure to get that to the question. It was about professional speaking. That would be great. Thank you all so much for today's panel. I can't believe that was an hour. It flew by. I learned so much more about each of you through our discussion. We would like to thank you, but we'd also like to thank the wonderful Applied Practice Experience site, your preceptors, your faculty who all worked really hard on making sure your projects were successful as well, and then you all for the amazing work that you've done. I'm going to pop a quick link into the chat. This is just a feedback form for this live student event. Every year we invite feedback so that we can try to make it better each time. You can take just a few minutes and give us some feedback for our student highlight event. That would be great. And while I do that, Vanessa's going to close us out.
Thank you, Kim. We also want to encourage you to view the APE conference webpage to see this semester's MPH student presentations. They have all worked incredibly hard on their projects, and their virtual conference page showcases that. We will post this link also in the chat so you can view the webpage. Presentations will be viewable in an on-demand format until May 5th. We encourage you to watch as many presentations as you can during the viewing period. For each presentation you watch, we ask that you fill out the presentation feedback form linked on the presentation viewing webpage. We have now come to the end of our live event. We sincerely appreciate all of you joining us this afternoon, and thank you to all of our student panelists. We hope you enjoy watching the student presentations and have a fantastic evening or day, depending on where you are.
Thank you all so much.